Hello everyone, my name is Dr. Gaurav Paul and I welcome you back to another exciting webinar. And today we'll be talking about scalers and the different types of scalers that are available in the market and specifically about Biosonic S1L. Before I get into the modern instruments, I would like to emphasize upon the different types of hand instruments that were available long back and how we had the understanding of gingivitis and calculus even back then, and the same remains so even today. It's just that the instruments have changed, but the understanding and the pathogenesis has still remained the same. Here you can see in the slide how Albuquerque in 936 AD made hand instruments which resembles our instruments. I mean, you can see the sophistication of the instruments that he made, and even then it is said that he realized that the cause of gingivitis was bacteria or germ producing organisms. These instruments got modified over the period of time and transformed into the instruments that we use today. And finally, with the transformation of hand instruments into ultrasonic devices, our work got a lot easier. In this slide, you can see the different types of periodontal instruments, and ultrasonic or sonic instruments are a part of powered instruments. So the basic advantage of powered instruments is that it increases our efficiency and makes the process much less demanding. So there is also sufficient evidence which indicates that the efficacy of hand instruments, or shall I say that the clinical outcomes of hand instruments and powered instruments are the same. Now, before we dive right into the powered instrument section, it's important to understand, and as we are taught in our colleges, we are first taught with the manual scalers, so as to understand how these instruments actually work. Obviously, the working of a manual scaler and an ultrasonic instrument has a lot of difference, but to understand the basics of periodontology, we need to understand what manual scalers are. So as you can see in this picture, there are a few basic types of scalers like curette, sickle, chisel, file, and hoe. They have their own indications, and the most commonly used among these would be sickle and curette. We have all used these in our college days, and we still use it in our clinic. So in this slide, you can find the differences between ultrasonic and hand instruments, and you can go through it at your convenience. But to point out the most important differences, the first is the aerosol production that ultrasonic instruments have. If at all it is indicated that aerosol production needs to be minimum, we have to opt for hand instruments. And the important advantage of ultrasonic instruments over hand instruments is that there is a significantly less chance of inducing trauma to the tissues with ultrasonic instruments. Now, this is perhaps one of the most important slides in the presentation. This is about the fundamental skills about how we should actually perform our practice. So, the position, the grasp, the finger rest, all of those have to be extremely ergonomic so that we don't end up hurting our back or something like that. And moreover, it should be comfortable to the patient. So a modified pen grasp has been recommended for all hand instruments, and it has been recommended here also. The finger rest will depend upon the quadrant in which we work upon. So the most important and the different thing about ultrasonics is the adaptation, because only the few millimeters in the tip of the ultrasonic instrument are active, and that is the part we work with. We do not have to adapt the entire instrument. Another important thing that has to be kept in mind is that only feather light touch has to be applied for ultrasonic instruments, in contrast to the hand instruments where we apply significant pressure. Powered instrumentations can be divided into two parts, the ultrasonic and sonic. Apart from the basic differences in their frequency, ultrasonic instruments work by converting the electrical energy and activate the crystals within the handpiece to produce vibrations, whereas in case of sonic instruments, high air pressure is converted into sound waves that produce the vibrations at the working end. So these are the two types of ultrasonic devices as I've mentioned in the previous slide. One is the magnetostatic, that is the Biosonic US100R, and the another one is the Biosonic S1L piezo scaler. So the basic difference between them, as I've already mentioned in the slide, but in the literature it has been suggested that the magnetostatic devices have been reported to interfere with the functioning of older cardiac pacemakers, but the newer ones have been accommodated and modified slightly to bypass that. Apart from that, the piezo ultrasonic scalers do not have any kind of offset as such, and they are very good instruments to work with. So before I get into the Biosonic S1L scalers, that is the piezo unit that Coltene provides, I would like to throw some light on the magnetostatic scaler that is available with Coltene. So apart from the basic features like the ergonomic handpiece and the 360-degree foot pedal control and all those stuff, it accepts both 25 kilohertz and 30 kilohertz inserts, which means that it will be able to provide dual frequency as and when it is required. Along with it, it has a turbo feature. With the turbo feature basically enables us to have that extra jolt of energy if it is required in clinical situation. Cross infection prevention has been the talk since the past 2 years, and the importance of this matter has risen significantly. So apart from the PPE kits and all the stuff that we use, we can also take some extra precautions like using chlorhexidine mouthwash to reduce the microbial load in the mouth before any aerosol generating produce procedure, or using high speed evacuation or HEPA air filters. All those stuff can really improve the confidence that we instill in our patients. Introducing the Biosonic S1L, among the many features which this device has, one of the most important and significant is the intelligent frequency tracking power, which basically means that this device can digitally control the frequency output and ensure that the device works consistently in any clinical situation. Apart from that, it has also an automatic cleaning program which makes our job a lot easier. There is an optic handpiece which makes the visibility very good, and it is applied with 8 tips which I'll describe in more detail in further slides. These are some of the specifications of the device. Now, this part is commonly ignored, but it has to be ensured that this device has proper voltage and all of the stuff that is required to function properly, because without that prerequisites, the device may not function properly and it may get damaged afterwards. So please ensure that these parameters are maintained so that the device performs at its optimal capacity. So these are the tips that are provided with Biosonic S1L. You can see that there are three lines, a green, yellow and red. This depicts the wear and tear of the tip. I'll be describing this in more details in the subsequent slides. But as of now, you can see that there are certain indications like green is okay. And there is a triangular yellow warning sign when it wears off 1 millimeter further than the green line. And when it comes to the red line, we should completely discard it. In this slide, you can see that I have displayed two types of working ends. One is the standard working end and the slim perio. The standard one is one which we all are familiar with, and that is a major workhorse in our clinic. And another thing that I wanted to point out here is that the cross section of the working end. A rectangular cross section is used to remove heavy calculus, whereas an oval cross section is used to remove stains. So this is one of the major concerns that we have in our clinics as to how to remove stains. So just by observing the tip of the working end, we can make out the difference for ourselves. So just like we have the sequential use of endo files in any RC case, we also have the sequential use of tips in our oral prophylaxis cases. So the first step is to use the standard tips and remove the heavy supragingival deposits. That is the first thing that we have to do in a medium to high power setting. And the second thing is that we need to go below the CEJ, but we have to keep in mind that we need to use slim perio tips because we do not want undue tissue distension, and we have to use this at a low power setting. And finally, to remove the light to moderate calculus in the root concavities and all of this stuff, we need to use specific tips that are available for that in a low power setting. So two terms that we frequently encounter during our use of ultrasonics are frequency and amplitude. Now, in a very short way, a combination of low frequency and amplitude is ideal for the removal of biofilm, and a combination of high frequency and high amplitude is ideal for the removal of tenacious deposits. So that is the main criteria. Frequency basically means how many times a working end vibrates per second, and amplitude means how far a tip moves back and forth in one cycle. In the previous slide, I've mentioned that for calculus removal, a high frequency and high amplitude is required. So obviously, if a tip is working with such a high power, the working end will also heat sufficiently and the water flow has to be corresponding to it. So the water flow for calculus removal is always going to be higher as seen in the picture than for deep plugging, where low frequency and low amplitude usually suffices in the clinical cases. There is a very stark difference between manual instrumentation and using ultrasonics. In the picture, you can see that when we do manual instrumentation, we insert the tip of the instrument at the bottom of the pocket and scrape it upward. Whereas in case of ultrasonic instrumentation, we usually start from the top, as I mentioned in the previous slides also. We start with the supragingival calculus and we go below till the bottom of the pocket. For biofilm removal, we should use the ultrasonic tip with as less pressure as possible and use it in a sweeping motion, like we would use a crayon in a color book or something like that. In a sweeping motion, we should go from top to bottom with minimal pressure, a feather touch pressure, as it is said in the literature, and the biofilm will be removed. We should not harm the cementum as much as possible. Obviously, in case of calculus removal, the disease cementum has to be removed, but obviously in case of biofilm removal, that is unnecessary. So if you can recall, in a previous slide I had shown the tips that are given with the device Biosonic S1L, and there were three lines: green, yellow and red. So here you can relate with that. The blue line indicates 1 millimeter wear of the tip from its original position, so that results in a 25% efficiency loss. And when the tip is reduced to the red line, that means a total of 2 millimeter has already been lost, and that results in 50% efficiency loss. This is the cue where you have to discard your tip and get a new one. This clinical picture is one of the most commonly presented cases in our clinic, especially with elderly patients. Now, there are 2 points jotted down in the slide. Please go through them, and these are some of the most important points that has to be kept in mind before we dive into our treatment planning, right? So before we treat this kind of cases, we need to make sure that we understand the etiology of the problem thoroughly and then dive into the treatment planning, otherwise failing to which our prognosis would suffer. We often encounter these kind of severe cases and we are overwhelmed by the complication of the cases. It is usually accompanied with diabetes, hypertension and other ailments as such. We just need to keep our calm and believe in phase 1 therapy. Now, what is phase 1 therapy? It is basically the oral prophylaxis, the complete elimination of all visible biofilm and plaque and calculus, and let the body heal for itself. We'll need follow-ups, definitely we'll need follow-ups, but after the first visit itself, we will see a lot of difference. And you, as you can see in the before and after picture, this is a span of around 6 months. There is a complete improvement in the case. So this is a much less severe case of periodontitis as compared to the previous one. There is a 4 to 6 millimeter attachment loss, and you can see that the case is completely improved over 18 months. But one thing that has to be kept in mind is that during these 18 months there were multiple follow-ups, multiple revisits, and biofilm control, failing to which these kind of results are not possible. Only after the motivation of the patient, which is very important, and it is always recommended that we have that kind of talk and the phase one at the clinical consultation itself, that the motivation of the patient is of utmost importance when we try something like this. So as I've mentioned in the previous slide, the importance of motivation in a patient. You can see here that this is just a 4-month interval. You can see the picture B how severe the calculus is, and D where the scenario is completely changed. But this does not happen just by the contribution of the practitioner. The patient has a big role to play in it, and the sole role that the patient plays is plaque control. So these are the tips that are available with the device, and you can see there are different indications for different types of the tips, and I have already generalized the tips in a different slide, so you can easily understand just by looking at the tip how you have to use it and at what power you have to use it so as to achieve optimal results. We all know how file separation can be a very complicated procedure in our clinical practice. So we have this E3SD tip which can be used to loosen the instrument in the canal and retrieve it. We also have the P4SD which can be used to remove calcifications in the chamber and also explore the orifices of the canals. And we have the E1S which holds the U instruments. U instruments are described in a separate slide, and these are some of the very good instruments that can be used with ultrasonics. So these files are known as U files. It goes into the holder that was mentioned in the previous slide, and these are available in ISO standard sizes and coloring. And these are basically used to enlarge the root canal, to make it smooth and flat, and to polish and grind the root canal. They are very effective instruments because it uses the vertical movement of the ultrasonic instrument of the U tip to produce the smoothness in the canal. There are three types of subgingival tips. Now, if you can see the tips, you can recall that slim perio tips were one of the categories which were used to excavate subgingival calculus and other stuff as such. So you can see that there are three tips available: P3S, P4S, and P1S, which can be used to that extent, which can be used in the subgingival area to remove calculus or plaque or anything as such.